Dr. Catherine Bayer is here tonight from Rockford Dental. Thanks so much for coming in.
Thank you for having me.
We want to hear a little bit about what you do and what happens at Rockford Family Dental that maybe is a little different than somewhere else.
Okay, good asking. I am a general dentist. I cater to patients of all ages. So we start our patients out as young as 3 months and take it all the way up to the end of life. Handicap, special needs patients as well. What's different about our office, we definitely do a lot of heavy education, the importance and the link between overall mouth health as well as the health of the body, making good food choices, treating early diseases early. Most people don't realize that inflammation we call gingivitis does definitely affect the rest of the body, oftentimes in a negative way. So primarily it is making sure that the mouth is as healthy as it can, give them treatment options for any treatment that needs to be done and see through that treatment, and then recare, keep them on the retainer visits to keep the mouth healthy.
How long have you been working in the Rockford area?
I've been in the area since June of 2012. Prior to that, it was 8 years in Freeport.
That's a long time.
And 8 years out in New York.
So, a lot of teeth you've taken care
of. A lot of teeth.
What made you want to do this for a living?
I think I got lucky with my calling. Cool. I know that I have always wanted to work on the face, thought it was the eyes, ended up with the mouth.
Okay.
Did my schooling at Marquette University.
Awesome.
Truly, you know, I started as a hygienist, and so that's why the preventive aspect of it is still the meat and potatoes of my practice.
Absolutely.
Trying to find holistic ways of keeping one's body and mouth health, that's key.
And that's so important. You know, a lot of people, not me, I like going to the dentist. A lot of people are afraid to go to the dentist, whether it was something that happened when they were a kid or kind of the fear of, it's been a while, like what do we do now? So knowing that there are really great people that are working there that are going to be able to talk you through the steps you need to take if it has been a while or something else, and that you actually really do focus on education not only with the patients but with other employees. It's a good thing to know.
I think fear of the unknown is what cultivates that fear in the dental office. And I think, first of all, we work in a very close interpersonal envelope.
Yeah.
And having somebody being that close to your person, you have to win their trust. That is the big thing. So, we do a lot of the buddy brushing. My young flossers and brushers oftentimes need the guidance of somebody who can help them through that. So it sometimes feels like a team sport.
Yeah.
As far as from the fear of it, I think knowing what the procedure is, and then, like I said, having the trust of that practitioner is golden. Our tagline out in New York was, "We cater to the cowards." And I always tell patients, it should never feel like you have to apologize that it's been that long. We are thankful that they've taken the choice of walking through that door, reestablishing, figuring out what that action plan looks like, and then helping, to follow through to preserve the mouth, get the health back.
Absolutely. I know you do a lot with pediatric care.
I do. So again, I'm not a pediatrician. I'm not a pediatric specialized doctor. Kids speak my language, I speak theirs. We try to keep things upbeat and have fun. I can't tell you, sometimes my big people say it's like staying for dinner in a movie. That yes, I feel like a teacher, I feel like stand-up comedy, I feel like a talk show host.
Yeah.
Because again, if the hands are moving, the mouth is moving. Everything is done with like a patient mirror so that they have the best seat in the house. They get a chance to really see what's happening in the mouth. There are no secrets. You know?
Awesome. Well, it sounds like a great time to encourage people to give you a call to come visit you at Rockford Family Dental. All the information is on your screen and on how you can reach out to Dr. Bayer. Thank you so much for coming in.
Thank you for having me.
Coming up next on GDS Tuesday Trends, we're getting ready for football season with workouts you can do during the commercial breaks. Don't go anywhere.